you, Aaron. Yeah. Okay. Magandang umaga sa inyo dyan. This is Dr.Jun Reyes, your physical therapist. Ang pag-usapan natin ngayon ay tungkol po sa mga physical therapy equipment that we have here para maging familiarize kayo pagka pumunta kayo sa physical therapy. Maybe, Aaron, we can lower the volume of the... Okay, maganda ang topic natin ngayon. Live po tayo. Papakita ko sa inyo ang clinic ko. This is my clinic. Doon po sa mga bago dyan. Ito po yung Reyes Reyes Physical Therapy Clinic. Ngayon nakakita ako ng mga 30 patients. Around that number of patients, 30 patients. And I've been promoting the CBD oil. This is the Nature's Prescription, 1,000 milligrams. Very effective. Effective po siya sa mga may high in cholesterol, nahihirapan makatulog. It's good for improve your immune system and those kind of things. And it's also good for chronic pain and inflammation. The good thing about this Nature's Prescription cannabidiol, this is the CBD oil. Malapit na pong dumating dyan sa Pilipinas. Ang product na to, yung CBD oil na to, we have a barcode. Yan. Ang barcode po na to, it means pwede nyo siyang ma-scan. It's analyzed by a third-party laboratory test. This is a laboratory test result. Pakita ko sa inyo yung, this is the cannabinoid profile that has THC. So ito yung mga certificate. So just to prove that it's legit, it's organic and non-GMO. Very effective po. Today is my first month of taking it. Ano ba yung mga nangyari sa akin after taking it? Nakakatulog po ako na maigi. I have yung blood pressure ko, normal po siya ang blood pressure ko. At mas energized ako. I'm active. I lost 3 pounds after taking this medication, after taking this CBD oil or cannabidiol, because we have our endocannabinoid system. Yung endocannabinoid system po natin, responsible for our metabolism, responsible for our immune system, responsible for your mood and your inflammatory reaction. All right, very effective. I sold more than 80 CBD oil na. This is a full spectrum. We have 2 products. One is a regular CBD oil and the other one has a THC. Okay, yan lang po para maging familiarize kayo dyan. Aaron. Okay. Alright, umpisa na po tayo. Pakita ko sa inyo, ano ba yung mga take care. Pakita ko sa inyo, ano yung mga ginagamit namin as a physical therapist. We have the electrical stimulation. Yan. Yan po ang electrical stimulation. And then we have the ultrasound. This is the ultrasound. And I like to use Dynatronics. Pero ang electrical stimulation, I'm not a big fan of it. I use it pagka ni-request lang ng pasyente. Pagka ni-request lang po ito ng pasyente, it's actually what we call transcutaneous electrical nerve stimulation. Ang ginagawa po namin, Aaron, if you can get me the electrodes. Alright, pakita ko po sa inyo ang epekto ng electrical stimulation. Alright, watch lang kayo dyan, ha? Okay, this is Aaron. Yeah. So, papakita ko sa inyo kung ano ang effect ng electrical stimulation. For example, the patient has pain here. Alright? So, we're going to use electrodes. Okay. Ilalagay lang po dito. I don't use this regularly. Pagka acute pain lang talaga o sobrang sakit, I would use the electrical stimulation. So, you would put the electrodes like this. Pakita mga Aaron ang connection. Yeah, so just like that, okay? Okay. Maybe you can grab a stool.
Okay.
Yeah. So you can put. Okay. All right. Kunyari, guys, we're doing electrical stimulation, or this is what we call transcutaneous electrical nerve stimulation. We use it for pain. Okay. Yan po ang placement ng electrodes. I'm gonna use pre-mode. So you actually can see, if I making it strong, you can actually see the movements of the muscles. All right, so we're starting now. Okay, is that channel 1? All right, we're gonna make sure it's the right channel, channel 3. Okay. All right, makikita nyo siya. I'm just changing the channel. Yeah, he actually feels it. See, that's how. Yeah, that's the typically we use this for acute pain, and we do 10-15 minutes of electrical stimulation or transcutaneous electrical nerve stimulation. That's good. With this, I don't really use this, guys. This is just temporary. After using it like 1-2 sessions, I stop using it. It doesn't really work. You can actually buy ng electrical stimulation dito for only $19. So it's very cheap. So I don't really use electrical stimulation. It's a waste of time. So I basically do manual therapy for the patients. Alright, so after transcutaneous electrical nerve stimulation, this is what we call ultrasound. Okay? This is the ultrasound. Ito ang ultrasound machine. So, at least you're familiarized with the machine right here. Okay, so when you go to physical therapy, you would see this ultrasound machine. Alright, so, and Aaron, with the ultrasound, we use this for example, if you have carpal tunnel syndrome, we use this for, I would use this for 7 minutes. 7 minutes, and then we do circular motion just like that. Okay? For 7 minutes. Like this. I like using this. It depends on the joint. Maybe a carpal tunnel syndrome, I would do the ultrasound, and then after doing ultrasound for 7 minutes, I would start doing soft tissue work and stretching. Ultrasound, it's a sound wave. We use sound waves so it can penetrate the skin, the muscles, the ligament, the tendon. So that's gonna help loosen up. Again, this is like secondary treatment. This is a secondary treatment using the ultrasound. Okay. All right. So that's the two equipment. So you stents, ultrasound. Now what we're going to use is, if you can get the Thera-Gun. Kamusta kayo dyan? Breakfast time na. Anong mga breakfast nyo dyan? Alright, Aaron is just getting the Thera-Gun. Alright. Okay, so this is the advanced Thera-Gun. This is what we called, I call it Thera-Gun. It's powerful. It's actually good for soft tissue work, like really deep muscles, okay? So I'm gonna use this, guys. So it's gonna sit here. Alright, so we're gonna use this, and it has level 1, level 2, level 3. See how strong is that? Alright, so we're gonna start with level 1. So we use it right here. Okay. And then we're gonna do level 2. Yeah. And then we do some range of motion. Alright. And then we're gonna do level 3. I think you can hear, you see how strong that is right there. Okay. So you can actually show, alright, and really go all the way to the muscles and right here. Okay, and that's when you move yung shoulder, just like that, and then move it like this. So effective to sa mga frozen shoulder. Use that machine. Okay, and then stop. So again, this is just parang warm up lang, pero we actually use our hands and then do soft tissue work and then stretching. So you're gonna do stretching just like that and then go just like this. All right, okay, so that's the Thera-Gun. What I'm gonna show you next is we're gonna do the mechanical traction. All right, I'm gonna show you how to do the mechanical traction. Okay, tutur ko kayo guys sa aking clinic. This is my waiting area. All right, that's my waiting area right here. And as you come, so for example, nandito kayo, pasok kayo. Okay, lakad kayo dito. Yan. Kunyari, nandito kayo sa clinic ko. Okay, katatapos lang, yan. And then my schedule is right here. You see my schedule, guys? That's my schedule. I have a full schedule. And then, mamaya magtatanong ako sa inyo. It's, I have question and answer portion. Maganda po kayo ng tanong na pwede kong answer. Siguro I'll answer 3 to 4 questions po, okay? Alright, so pasok kayo dito. And then we have the cross trainer, okay? And then we have the weights, okay? Just like that, the treadmill. This is, and then we have all the beds just like that. All right. Now I want to show you. Oh, right. Like show them the. All right. So wear the harness. Okay. So. Okay, so ang pasyente, nagwe-wear siya ng harness right here. Okay? Tapos, ikakabit natin itong bracer na yan. And then you're gonna use the treadmill. Okay? Alright, so Aaron, let's go do that. Okay. So, yung pasyente, so, kung ang pasyente may problema sa paglakad, naka-attach siya doon sa taas na yan. So, as you can see, is attached sa harness. Yeah. Okay. And we're the only one who has that in this town. Very effective po siya. Madami po tayo natulungan dyan. May mga pasyenteng may Parkinson's, mga pasyenteng they had a stroke. Yan, they had a stroke and madami tayo natulungan sa paggawa ng ganyan. So I want you to feel like nandito kayo sa office ko, dito sa clinic ko. Pinapakita ko yung aking clinic. All right. Now, Aaron, that's good. Now I'm gonna show you the mechanical traction. Kung nagpunta kayo sa mga clinic, ito yung mga makikita nyo sa physical therapy clinic, guys. We're gonna use the mechanical traction. This one is a mechanical traction. I'm gonna show you how we're using the mechanical traction. For example, the patient has disc herniation or general stiffness ng neck. Okay, papakita ko ang paggamit ng mechanical traction. Alright, so this is the mechanical traction right here. Yan ang mechanical traction. So, Aaron, if you can lie down here.
Oh my God.
Mm-hmm.
Oh, my neck goes here.
Yeah, your neck goes here. Pakita ko muna sa kanila, ha? Okay, guys. Aaron is gonna lie down. Ito yung... Yeah. So just like that. Okay. Yan. Alright. So, nakakonect tong traction right here, yung headrest. And then we're gonna put this one on his forehead. Yeah, that right there. Okay. Just like that. Okay. And watch this. This is really awesome. Alright. And you can actually see the movement of the head. I like using this. It helps my patients. Alright, watch this, guys. Alright, you're gonna see this. Watch that. What's gonna happen, ipupull tong neck niya all the way up. Okay, ipupull niya yung neck niya na ganyan. Alright? Okay, we're gonna start. Yeah, so... Are you okay, Aaron?
Mm-hmm.
Yeah. You feel the pulling?
Yeah.
Yeah. So, kikita nyo, this is what we call mechanical traction for the neck. As you can see, we do this mga 20 minutes. 20 minutes po. We do intermittent traction. Tapos, bababa siya. And then, magpupull siya ulit. Okay. And then, it's gonna relax. Si bababa naman siya. Yung ganyan. And it's gonna pull his neck. Very effective po ito sa akin before I do manual therapy. Very effective siya sa mga general neck pain, stiffness, and some disc herniation and those kind of things. Let's do this for like 10 more seconds. Okay? Right. And stop. So you can remove that. All right, Aaron, you okay?
Mm-hmm.
All right. Okay. Thank you. Okay. Let's go back to here. Alright guys, yan po ang aking adjust lang natin to ng konti. Okay, yan po yung mga physical therapy equipment para ma-familiarize kayo dun sa mga ginagamit ko dito sa physical therapy, sa Reyes Reyes Physical Therapy. Yung mga TENS electrical stimulation ultrasound, I use it like 1 or twice and then I stop using it. Ang main treatment ko yung mga stretching exercise, how to do for the neck, how to do self or home exercise program yung pinapakita ko sa inyo. Mga low back pain, ayan, after doing ultrasound, I'll do manual therapy and then stretching and then exercise. Ang pinaka-importante po na matututunan nyo sa physical therapist is how to do the right exercise. Ang tamang gagawin, quality movements. Yon, pagka alam nyo na yung exercise, you don't need to spend a lot of money to see a physical therapist. Kasi it's very expensive, especially dito sa United States, we have a high copay. So, ang gusto ng mga pasyente, they learn how to do their home exercise program. So I'm helping them learn how to do home exercise program. Of course, they need me for manual therapy and stretching. Effective po yan. Alright, let's start po tayo some general questions. Feel free to ask questions. I'll try to answer yung questions nyo. Okay? Let's see if we can see your questions right here. So good morning, Aaron. Could you check if they have a question? Maybe there's a question on that side. Yes. What's her name?
Normita.
Nanita. What's her last name?
Operana.
Okay. What's the question?
How much?
Yun pong CBD, paano gamitin? How much po yun? It's about the CBD. All right.
Yeah.
Unfortunately, sa Philippines, we don't sell it to the Philippines because illegal pa po ang CBD oil sa Philippines. Meron po mga CBD oil. Did they return the CBD oil?
Yeah.
Okay. Meron pong binebenta sa Philippines na CBD oil that's made in China. Yung pagka pumunta kayo sa Lazada, they're selling it for like 800 pesos, 300 pesos. Be careful na bilhin niyo po yan kasi ano yun, fake yun. I'm not really, hindi talaga ako maano sa mga China-made. Yung mga binibili kong China-made, I mean, yung mga gadgets, madali pong masira. Yan. Ito po yung certification sa CBD oil. If you have any relatives na nandito sa Amerika, they can purchase it. So kung may mga kamag-anak kayo dito sa US, they can purchase it. Alright.
That's another one.
Alright, so there's a question. Doc Jun, di ba nasa everyday workout sa gym? If so, how many times a week ang dapat mag-workout? Okay. Pagka mag-workout po tayo, make sure you designate, like for example, if you're working out on the shoulder and your, I would say shoulder and chest, you can work out the shoulder and the chest. Shoulder and back. You can work out the shoulder and back, and then for the chest and your core exercise. So you can spread it. You can work out every day. Just make sure you target different body parts, okay? But ideally for me, I work out 3 times a week. Alright, baka nakikita yung daliri mo. Yeah. Alright, don't move it too much.
Yeah.
They get... Alright. Alright, I'll answer 3 more questions. Alright, I can't see it. No, that's... Yeah, let's change it. Yeah. Alright. Okay. Don't move it too much.
Yeah. I think that's it.
That's it. That's good. That's good. That's good. Yeah. Just leave it like that. Alright. Ano pa ba? Ano pa bang... Alright, so CBD oil, it's good for inflammation, chronic pain. I'm just waiting for your questions. Kung wala nang magtatanong. Alright, so that's it. Yan po yung mga physical therapy equipments na ginagamit namin dito. If you have any more questions, just send message sa YouTube or dito sa Facebook. I'll try my best to answer it. There's a question here. Alright, so I'll do it.
Okay.
Okay. May tanong si Elena Liwag. Ano po ang mga exercise ang pwede sa spinal? What do you mean spinal? Is it a spinal, a spine, cervical spine, or lumbar spine? If it's a cervical spine, I have a video for the neck, and then for the lower back, you can just go to the lower back video, okay? All right, may question. Doc, some exercise idea po about finger. What kind of finger injury? If you have a trigger finger, you can just do some range of motion. You start like this and going this way. Start like that, going this way. Start like this, going this way. And then you can do gentle stretching po, ano? Gentle stretching, going this way. Stretch that thumb. Stretch this. Stretch individual fingers. Yan. That's like this. And then you can do some rotations. It's like this. 3 sets of 10. And then you can go this way. And 3 sets of 10. And then you can do some prayers position, just like that. And hold it for 5 seconds. And then 5 seconds. Alright? 5 seconds. You can do 30 seconds and then just less repetitions po. Just like that. Okay? Last question.
Is this one is like
Alright, there's a question. Doc, pwede po ba ang batok pag high blood pressure? Pwedeng i-massage ang nape area dito sa batok, dito sa neck area? As long as it's gentle and not stressful, just gentle movements, okay? Just like that. And then do some range of motion, just like this. And then slow. You don't want yung sobrang sakit, yung mga massage, yung parang dinudurog siya. Just gentle movement. And then massage the area right here. Actually, nakaka-relax siya. Nakaka-relax siya. I wouldn't be surprised pagka bumaba ang blood pressure po. Ano? Ang blood pressure, as long as you're doing gentle, medium pressure, okay lang po i-massage ang batok just like this. And then just stretch it and range of motion all the way and extension. Massage lang po yun dito. And then the forehead, just massage the forehead and then all the way to the jaw. All right? Okay guys, that's it. I'll talk to you soon. I'll try to create a video about oh, by the way, meron pala akong kaibigan na she's gonna talk about herbs and spices. So watch out for the herbs and spices. She's gonna talk about ano yung mga natural ingredients na pwedeng makatulong sa mga may high blood pressure, sa mga may chronic low back pain. And then I'll talk to you soon. And maybe in the future we'll have some giveaways. Okay? I'll talk to you soon. And in the future I'll try to do some giveaways for those people who's gonna answer my questions. All right? I'll talk to you soon. Thank you guys. And by the way, Aaron, by the way, please subscribe po sa YouTube ko, Dr.Jun Reyes PT DPT. And thank you for sharing my videos. Doon po sa mga bago dyan, please like and follow us on Facebook and share our videos. Take care. Bye-bye guys.